What is Legionnaires' disease? Following a series of outbreaks in the UK, Legionnaires' disease has developed somewhat of an elevated profile. These recent incidents serve as poignant reminder that it is important to be vigilant about such things as Legionnaires, what its symptoms are and how it can be spread so as to prevent this. About Legionnaires' disease. Legionnaires' disease, sometimes although less commonly called Legion fever, is a form of pneumonia that is uncommon and is caused by the Legionella bacterium, a widely found water-dwelling organism. The name arises from a breakout of the disease in the 1970s at an American Legion convention in Philadelphia. The disease is incredibly uncommon, however, when contracted by a human can be life-threatening. Legionnaires' disease can affect people of all ages. However, it is more prevalent in men than women, and has a greater effect on the over 50s. Those who smoke and those with a weaker immune system are also potentially more likely to be affected by Legionnaires. Symptoms of Legionnaires' disease. Research has shown that people can become infected with Legionella bacterium and suffer from no symptoms at all. However, those who do present symptoms can suffer to a heavy degree if the right treatment isn't administered. The main symptoms of Legionnaires tend to be flu-like symptoms, such as tiredness, aching muscles, headaches, fever and a dry cough. This can then lead to pneumonia. Additional symptoms that may not always present include diarrhea, vomiting, breathing, and chest problems alongside confusion and a lack of coordination. The disease tends to have 2-10-day incubation period before symptoms present. This helps it to be defined as separate from other forms of pneumonia which have a shorter incubation period, often a few hours. How does Legionnaires' disease spread? Because Legionnaires is waterborne, then it is contracted by inhalation of water droplets that contain the Legionella bacterium. This can travel for over 6 kilometers, but can't be spread person to person. Places such as cooling towers, complex air conditioning systems in buildings and other areas where water can pool are the kind of places where bacteria can breed and multiply. How to treat Legionnaires' disease? The only real way to treat Legionnaires is via a course of antibiotics. The course and strength of this is dependent on the severity of the patient and how their health in general is. If the patient has a pre-existing condition, then this can make the condition worse and more care and attention is required. Preventing the spread of Legionnaires' disease. In order to prevent the spread of the disease, then it is important to ensure that all areas where Legionella bacterium can grow and multiply, then they are treated with bactericidal chemicals. Also, this can be done using the Sinai packing range from GIA2H Water Technologies. The product works by disrupting the metabolic process of unwanted microorganisms, disallowing the bacterium to form and grow.